Welcome to our video about how to get rid of bad breath in the morning. There are many reasons why you may experience morning breath. There are many factors to consider, including your diet and how much caffeine or alcohol you consume. In addition, you might have dental issues such as a cavity. This video will give you tips to get rid of bad breath fast. Caffeine, alcohol, smoking, and dry mouth can all cause bad breath in the morning. Avoiding these substances is essential to improving your breath and preventing bad breath in the future. Dry mouth. Dry mouth is a common problem among older adults. The causes are varied, but may include lack of proper nutrition and prescription drugs such as antihistamines, decongestants, and antacids. In some cases, cancer treatment may cause dry mouth by reducing the salivary glands. Eventually, this production will return, but the damage may be permanent. Radiation treatments to the head and neck can also damage these glands. Other causes of dry mouth include snoring and sleeping with the mouth open. In general, morning breath is a symptom of poor oral hygiene. The mouth naturally produces saliva during the day to wash away bacteria. However, as you sleep, saliva production decreases, which results in a dry mouth. Bacteria and food particles become trapped in crevices in the mouth and cause odor. If left untreated, the smell of morning breath can worsen or even develop into periodontal disease. Luckily, there are ways to counter this problem and keep your breath fresh throughout the day. One effective solution is to drink more water. Not only does drinking water help keep the mouth hydrated, but it also helps rinse away food particles that have stuck to the teeth. It is also a good idea to brush your tongue to remove any trapped particles. While brushing your teeth is important, brushing your tongue is equally important. During this time, you can also use a sugar-free gum to keep your mouth moist and fresh. Caffeine. Coffee can lead to bad breath. However, it's not the actual caffeine that's the problem. The ingredients in coffee are to blame. The acidity and sugar content of coffee encourages bacteria to grow and reproduce, causing bad breath. Also, caffeine makes people more susceptible to halitosis bacteria. For this reason, coffee is not an ideal drink for those who suffer from morning breath. Here are some of the ways to avoid smelling like a coffee drinker. Another reason for bad breath is poor oral hygiene. While we sleep, our mouths are not adequately cleaned overnight. Consequently, bacteria can breed and build up, causing bad breath in the morning. Proper brushing and flossing are essential to keeping your mouth fresh and bacteria-free. If you can't do this, consult your dentist and follow his or her advice. You can also consult a dental professional if your morning breath is particularly bad. A study published in the Journal of Breath Research found that coffee can reduce the amount of sulfuric compounds in the mouth. It also reduced the production of volatile sulfur compounds, which are responsible for bad breath. To reduce the amount of these compounds, brush your teeth after drinking coffee. You can also use toothpastes containing clove oil or zinc. This may help reduce the effects of coffee breath. Also, drink plenty of water during the day. Alcohol. Drinking too much alcohol can leave you with unpleasant morning breath. When you consume alcohol, the body breaks it down to acetic acid, a less harmful chemical that can be released through the sweat and respiratory system. This chemical is responsible for the unpleasant smell that is associated with alcohol. Be aware that drinking alcohol also causes stomach odor, which is especially noticeable after belching. The worst offenders include liqueurs. Watch to find out the ways to get rid of bad breath and protect your teeth. A common way to mask the smell of alcohol is to eat food with a strong smell. Many cultures finish their meal with a herbal chew. For example, Mukhwas from India chew on coconut, fennel, and anise to freshen their breath. But remember, mouth fresheners don't work long because bacteria continue to grow in your mouth after drinking alcohol. To combat this, you can also gargle with water or consume foods rich in garlic and onions. While drinking alcohol leaves your breath smelling bad, it also dehydrates your body. This leads to a heightened growth of bacteria, so it is important to drink water to flush the odor away from your body. Alcohol also makes you smell like a beer, so you should avoid drinking alcohol if you have morning breath. Aside from causing morning breath, drinking coffee and whiskey can also contribute to the smell of your breath. Smoking. While the main cause of morning breath is the buildup of bacteria overnight, there are other factors that contribute to bad breath. Eating foods that are rich in aromatic compounds releases compounds that enter the lungs and bloodstream. This in turn gives off a bad odor. Additionally, smoking has the added effect of dampening the sense of smell. So, what exactly causes morning breath? Keep reading to find out. Keeping hydrated is crucial for the control of bacteria in the mouth. To avoid the odor caused by morning breath, you should try quitting smoking. Quitting smoking will immediately improve your breath, but it is important to maintain excellent oral hygiene. Brushing your teeth at least twice a day, flossing daily and using antiseptic mouthwash will help prevent morning breath. If you can't quit smoking, it may be best to see a dentist to see what's causing your smelly breath. Aside from the bad breath caused by cigarette smoke, smoking can lead to other health problems. It reduces your immune system and inhibits blood vessel growth. The most obvious solution is to quit smoking. You can help the entire family by cutting down on your smoking. By limiting your intake of cigarettes, you will improve your overall health and eliminate the odor caused by morning breath. If you're a smoker, stop immediately. Snoring. If you notice that your morning breath is not as fresh as it used to be, you may have a sleeping disorder known as obstructive sleep apnea. Obstructive sleep apnea causes pauses in breathing, which can lead to fatigue during the day and depression in the morning. The condition is common, affecting as many as 2% of adults. Symptoms of sleep apnea include: the snoring sound is caused by the rattling of soft tissues near the airway during sleep. Because the air is forced through an obstructed area, these tissues vibrate. Over time, the noise can become loud and piercing, indicating sleep apnea. A wide range of non-surgical and surgical treatments are available to help reduce the frequency of snoring. Snoring is most common among overweight and middle-aged men. Symptoms of primary snoring include increased risk of stroke. Stroke occurs when the blood vessels in the brain become blocked, often due to vascular calcification. Without sufficient blood flow, brain cells begin to die and the body shuts down. It is important to visit a sleep physician if your snoring is too loud or if your morning breath is too smelly or is getting worse. Flossing. There are several reasons why people suffer from morning breath. Generally, poor oral hygiene is the cause of this problem. Brushing and flossing your teeth daily can eliminate many of the bacteria and food particles that contribute to bad breath. Without proper cleaning, you could even develop tooth cavities and gum diseases, such as gingivitis and periodontitis. Luckily, there are ways to combat these symptoms and freshen your breath every day. Flossing and brushing your teeth before bedtime is an excellent way to minimize or eliminate morning breath. A few minutes of brushing will remove more food than 2 quick swabs, and a little flossing will clear away around 40% of food debris. Flossing and brushing are especially important before bed, since you don't have the same flushing power as you do during the day. After brushing and flossing, alcohol-containing beverages should be avoided. Drinking alcohol promotes dry mouth, which leads to foul breath. During sleep, saliva flow stops and people who drink heavily are likely to suffer from morning breath. As a result, mornings may be the best time to brush and floss your teeth. However, if you are unable to brush or floss at night, it might be best to give it a go in the morning. Cleaning your tongue. Brushing your teeth and flossing daily are essential for keeping bad breath at bay, but it's also a good idea to clean your tongue regularly. The grooves in your tongue are a magnet for bacteria, dead skin cells, and food particles. A thin layer of mucus on your tongue also traps bacteria. By regularly cleaning your tongue, you'll be removing these substances, which will make your breath fresher. The best way to clean your tongue is with a toothbrush. If you have a gag reflex, start by brushing your teeth and tongue, and spend 15 to 30 seconds cleaning each area. Once you're done, rinse the brush and make sure to clean your gums and roof of your mouth as well. Then, repeat the process until you've completed your task. If you're having trouble brushing your tongue, try using a flossing floss or a manual toothbrush. To clean your tongue, first purchase a tongue scraper. These are available at many pharmacies and grocery stores, or you can search online. Use a spoon or tongue scraper to remove any white film that's on your tongue. Stick your tongue out as far as you can, so it isn't stuck in your mouth. Brush your tongue before brushing your teeth to reduce morning breath. This will make your mouth fresher and will ensure that you have a good breath. We are so grateful that you stayed to the end.